One therapy typically used in physical therapy over the last 50 years has been ultrasound. It's the use of high-frequency sound waves to pummel tissues and loosen up stiff joints. A probe containing a device called a transducer is rubbed over the skin. Electrical impulses are converted to sound waves, and these sound waves penetrate the skin, muscles, and connective tissue. The frequency is so high, the human ear can't hear the sound. Ultrasound can break down calcium deposits, expel debris from the tissues, and free up circulation. Of course, as ultrasound therapy developed, they tried it on many types of conditions, including arthritis. I was reading about some of their observations that were recorded in the September 1965 issue of the Journal of the American Physical Therapy Association. Something about the way they were doing ultrasound back then intrigued me. They certainly were getting good results. Back then, the equipment had a variable control on the frequency of the sound waves. The therapist could choose what frequency range to use on what condition. They mentioned using a range from 800,000 to 1,000,000 impulses per second. A later study of ultrasound treatment of arthritis patients was published in the April 1970 issue of the journal Physical Therapy. They treated 120 patients and had great success, but they noted that, quote, the lower frequencies were more effective, end quote. Now, let's examine this for a minute. I know from my studies and experience with electrotherapy that the lower frequencies are the most effective with arthritis. That's why galvanic electrotherapy and sine wave therapy, as applied in our treatments here, are done with low frequencies. Even acupuncture is more effective, I've found, with a manipulation of the needle that matches the speed of the electrical impulses that we use in our machines. Now, here's this physical therapy expert in the journal article, Dr. James Griffin, telling me that the same thing is true with sound waves. Well, seems to make sense. What does not make sense is the way ultrasound has come to be used since that time. If you look at the equipment being favored in the field today, you will see that they are manufacturing machines that produce a 3 megahertz frequency, 3 times higher than the highest frequency that was used in the old days when they were so excited about its use in arthritis. You've probably noticed that I have a lot of old equipment here at the clinic. This is no accident. I believe that modern equipment is designed to make the practitioner think he's getting something better with all the fancy features and the modern look, but that will not produce the results that they were getting years ago. I use the lower frequency when ultrasound is indicated and have no complaints. Dr. Griffin said, quote, the superior pain-relieving effects of low-frequency ultrasound in shoulder, vertebral, hip, and knee lesions are assumed to be the result of greater depth of penetration of this frequency, end quote. If you research medical methods, which I do, you continually come across things that worked very well and then were buried. It's very frustrating. Fortunately for you, I'm just angry enough about it and stubborn enough to rescue these methods for your benefit. I just want you to understand why I do things the way that I do. Thanks for watching.